Hi, welcome to the Bari Nation podcast, where we support the bariatric community with humor, humility, and honesty. I'm April.
And I'm Jason.
Hi.
Today.
And I'm Day.
Day, we have the pleasure of welcoming somebody to the podcast today that you've probably never seen. She's not a bariatric patient herself, but she has years of experience working with bariatric patients in the dental care field. And Day is not only an amazing member of the greater bariatric community, somebody that is a supporter and a friend of our community, but she is actually the woman behind all of the merchandise that you have been seeing from Bari Nation. I know. And let me tell you, friend, people are loving it. Those tumblers, those beanies, those blankets are, oh my God, life. I mean, you are such a multifaceted woman. You know, when we first met months and months and months ago, I knew that we had a very friendly connection. Mm-hmm. And then the more that you and I talked, just on a personal level, I was blown away at your involvement with the bariatric community, just kind of like from a secondary level, you know, from a friend perspective, from your dental background, and just all of the supports that you do. So we are just so excited to talk to you about this form of self-care that often goes overlooked, which is dental care.
Absolutely. Absolutely.
Right?
Yes,
so,
absolutely.
So before we dive into the conversation, we always love to give our guests the floor to just kind of introduce themselves. So please let our friends and listeners and watchers know a little bit about you. What makes you you?
So first of all, I would like to say thank you to April and Jason and the whole bariatrics community for having me on your podcast and being a guest on your show. I'm honored to be here today and to speak to you a little bit about my little bitty knowledge and share with you about what I know. But let me share a little bit about myself. My name is Day Chanel, actually, but I go by Day. And I am a mother of one, but I also have 4 stepchildren, and I have 7 grandchildren, and I am married to a fabulous man named Regis Sager, who has a very intricate role in the Bari Nation community as well. So
yes, he does. We're legit family at this point. We can just say that. Regis is the gentleman that brought the Bari Nation website and community together as one. And that was like a feat of moving mountain ranges. And the fact that he got it done was just unbelievable. So yeah, no, you are family. You are very
Yes. And with that being said, we have been connected with the Bari Nation family by, I say, divine connection, honestly. And you know, myself and Regis do a podcast as well. And we were connected by that podcast family to April, and it's just evolved from there. And it's just like, wow, just, you know, so glad to be here. But also a little bit about me besides doing the podcast. I have a company. It's called Day-to-Day Creations, which I do the merchandise behind. And I started that last year when I left my job as a dental assistant. I was a dental assistant for, actually, I don't want to say was, because I still am from time to time. I have not left that whole dental world. I still dibble and dabble in it, but I left the office that I was working in, and I've been in dentistry for 23 years. And I do miss it. I miss the interaction and whatnot, but I ventured off to do Day-to-Day Creations, which is a custom apparel company. And I do apparel for small to medium-sized businesses and sports teams. And then also I host a market. It's called the Melanated Market. Now what the Melanated Market is we take vendors, small businesses, medium-sized businesses, and we create a platform in the community to host their businesses and their products. So currently we're in the South Hill Puyallup Mall, and once a month we do our market, and these vendors come out with their crafts, not just crafts, but
it's everything. I mean, it's
a little bit
of
everything. We've had the Washington State Foster care come in, where they've come in and they've had where they put out there for foster parents. So it's just all sorts of and types of businesses that connect with us to let people know what services they offer. So yeah,
it's pretty rad. I mean, it really is. You've created this amazing, really affordable and accessible place for these small businesses to come together and sell their wares. I mean, it's incredible. And it's a win-win because you're using space in the mall that hasn't been utilized in a very long time because of COVID. And
yes,
you're allowing this amazing platform for these businesses that couldn't otherwise afford a storefront to basically have a storefront for the day. I mean, it's like
absolutely.
it's a farmer's
Absolutely.
market. It's a twist on the farmer's market.
Yes, I was going to say that it's an indoor farmers market. So yeah, so it's been awesome and it's been great. And we're looking to partner with some other companies and just getting out there in the community and letting people know that, hey, we're here. Come check out these small businesses, especially during this time. I know we see some of the bigger businesses, but also the small businesses are struggling during this time too. So yeah, let's get out there and support.
Yep, absolutely. Well, I know that was why it was important for Jason, Natalie, and I that we found somebody local to one of us that could help us with our merch. We wanted to stay local. We wanted to stay small. And we're so thankful that we were connected with you. I totally forgot that it was like a year and a half ago that we actually were connected by the podcast. Right? Time flies when you're having fun.
Yeah, right?
All right, friends. Well, today's conversation is really going to focus on self-care through the lens of dental care. It's not something that I think people think of often. I am the type of person that the only nightmares I have are me getting my teeth kicked in, and I will explain that why later on in the podcast. Right? But I mean, our oral health is really a reflection or our earliest indicator of our overall health. And it is just something that I think a lot of people think isn't a big deal, but it is extremely important for not only our immediate health in the moment, but our long-term health. So today's conversation is really just going to focus on self-care is dental care and how before and after bariatric surgery, especially after bariatric surgery, we really have to be diligent about how we care for our mouth, how we care for our teeth and our gums and all these things that like allow human life to kind of function. So it's going to be a good conversation. I think we should dive in. You ready?
I'm ready.
All right, let's do it. So the first question I actually want to ask is actually to you, Jason. How, on a scale of, let's say, 1 to 5, 1 being I'm the worst, 5 being I'm fastidious about your dental care, where do you fall? And what is kind of your daily routine when it comes to taking care of your teeth?
Outside of the brush and mouthwash situation, I would probably put myself at about a 2.5 because me and the dentist do not get along. Absolutely not. I had a horrible situation when I was younger that was like a nightmare for me. So to get me to the dentist is like, I don't know if y'all used to watch the A-Team, but to get Mr. T on a plane, how they had to drug him to get him in, that's me going to the dentist. Like there's videos, my wife has videos of me in her phone, just, I mean, drugged beyond belief to get me to go to the dentist in the first place because I have to take 5 milligrams of Valium and Halcyon just to get me there. Then they have to have gas on and more Valium after I'm there to be able to even work on me. So I have to usually go about an hour ahead of my appointment time to make sure that I'm good and zonked out of my gourd before they'll even work on me.
What on God's green earth happened to you that made you so freaked out?
So I was like 7 or 8, I don't remember, but I had a cavity and I was getting worked on. And the dentist was like, if you feel pain or whatever happens, raise your left hand. Make sure it's your left hand. You'll raise it up. I'll know, and we can stop, and everything will be fine. And I was like, got it. My mom wasn't back there. Nobody could be back there with me. It was just me and all these, adults. And so as he gets to trying to numb me up or whatever, so I'm freaked out anyway. So as he's trying to numb me up, I wasn't numb. So he starts just to get into drilling, going to town, and it hurt. And I'm trying to lift my hand up. And he put my hand down. He's like, you're in the way. I can't see. And so he kept going. And like, my man was drilling for oil at this point. Like he was going for the gold. So he's really having at it. And I'm trying to raise my hand. and he put my hand down. He eventually put his knee, had his assistant put her knee on my arm so I couldn't lift it up, and told me they were going to strap me down if I didn't stop, causing trouble. And I'm like crying at this point, and I'm like trying to holler out, and it was like, you got to stop or I'm going to hit your tongue with the drill. Like, you got to quit. And they just went to town. Like, they did what they had to do. And by the time it was done, I was wrecked. And I hurt like hell because and then I was all swollen up from the experience. And so it was many, many years before I took I was a teenager before I went back to the dentist. At that point, I almost drove myself. Like, it had been that long since I went back, because I was like, yeah, no, I'm not doing that again. And so from that point, I had such an extreme phobia of going. Then one dentist was finally like, well, we're going to try some Valium. And the Valium wasn't enough. And so between Valium, 2 doses of Valium, Halcyon, and all the gas that they could possibly muster to give me without killing me, because I'm not a small man anyway, but literally the gas has to be on to the point I feel it blowing on my face. And I have to like seal the mask and like really take a few of the deepest breaths to be able to, like, I have a dentist that will know by the way I respond to him when he asks me if I'm ready. Like, if I answer him too fast, he'll say he's going to come back. But if when I finally get to a point where I'm like, yeah, I guess we can do this, and they'll be like, okay, we're ready.
Oh my gosh. Day, is this something that you see often in the dental world?
It's funny that Jason mentioned that, and you wouldn't be surprised the number of people that have dental fears and phobias. That's a common thing to have. One of the things that I did specialize in the office that I was in was doing dental sedation on patients that have fears. One, that's trauma that you have from a child. Also, you can, there's ways to get past that and ways to get help with that. One is counseling, because really it is a trauma that's caused from something that's in your past. And I'm so sorry that happened to you as a child. Dentistry has, and it's because the lack of knowledge, dentists and assistants not having the compassion for their patients that they do nowadays. And during that time, dentistry was like, a whole just kind of like drill, fill, get it done, strap you down kind of thing, where today dentistry is not like that. As Jason mentioned, they do have drugs that help you with your anxiety. One of the things that we offered was a lighter sedation. There's 3 levels of sedation. There's one where there's just you take a diazepam, a Valium and you come in and you do your dental appointment, which is to make you really relaxed. The second is more a conscious sedation, where the night before you take the diazepam to help you relax. Secondly, the morning of, the dentist gives you a prescription for either lorazepam or triazolam. And so what this does, it takes away your whole memory of the dental appointment. It makes you relax. You're able to respond to the dentist, talk with the assistant and everybody in the office, but it takes away the whole memory of the event. And that's one of the ways that people are able to cope and deal and have dental treatments done. You can do that for your cleanings. You can do that for any type of procedure that you need to have done. Thirdly is full-on sedation, where you're totally knocked out. And typically that's for people who have high and extreme fears. You mainly see it when you go into have teeth extracted. Your oral surgeons do that type of sedation for you. But yeah.
Wow.
I was a huge fan when I found out that was a thing. I was like, oh, I can go to sleep for this? I was like, oh, sign me up for that. Because, because you have to think about it. Like Dave said, this was like 1982, so they didn't know anything. I'm lucky they didn't just use a work boot and knock whatever out they needed to work out. We're talking early 80s, baby. There was no rules back then. It was all go, no quit.
Absolutely. Absolutely.
Well, and I guess, and the interesting thing about what we just talked about is that I guess I just didn't know that dental fears was such a big thing, but I can understand why. I've had a lot of dental work done in my day, and there have been very few instances where it's like, oh, I wasn't quite ready, and that really hurt. So I can't imagine going through an entire procedure without any type of, pain assistance. But then to also know that dental care is such an important part of not only self-care, but of our healthcare, that it's something that we need to really stay on top of. And if we are experiencing this anxiety or this fear around our dental care, there are things that we can do to make sure that we are seeing a dentist on a regular basis, because it's critically important for our overall health.
Absolutely, absolutely.
Wow.
The whole thing is people and pain is associated with going to the dentist. So what is you ask someone, what's the number one thing when you think of going to the dentist? They're going to say to you, pain. And it necessarily doesn't have to be like that. You always, and I don't, for some reason, people don't like to speak up when they're in the dental office. And so that's one of the reasons why they don't go to the dentist. And one of the things that you mentioned, April, was why don't people go to the dentist, or the lack of. So your overall health is very, very important. It plays a whole importance on the totality of your body, because we start with the mouth. Everything we put in our mouth, that's how we ingest and get all our nutrients and things like that. So when your overall health, your dental health is not good, and it plays a huge part on your body, especially if you have underlying health conditions like heart disease, diabetes, things of that nature, and it affects your overall health. It affects your teeth and it affects your gums. And people don't really realize that if you have these underlying health conditions, that can be detrimental to your overall oral health.
Well, I literally, I don't remember my dreams often, but the only nightmares that I remember are either me getting my teeth kicked in or losing my teeth. Oh, wow. And I think it's because, but I have, like, somebody could go to out-of-state university for the amount of money that my parents spent on my mouth. I've had teeth removed. I've had my jaw dislocated and relocated. I just had all kinds of stuff going up here. And then I had braces for about 10 years. Mm-hmm. So there's a lot that went into this smile. So I don't want this smile to be ruined. Yeah. Right. And I just, it makes me so panicked to think that something could be going on with my mouth, not only because our smile and how we present is one of the first things that people see. And Jason, I'm always on you because I know you never smile with your teeth, because it's just not something that you, right, me? It's just not something that you love about yourself. But if we don't have healthy teeth and gums, we're not going to be able to consume the foods that we probably should be consuming. Absolutely. And it just, right, like it's an indicator of what's happening in our own body. So caring for our teeth and our gums and caring for our mouth is like one of the best ways that we can care for ourselves. If our mouth and our gums are healthy, then it kind of indicates the rest of our systems are healthy, correct?
Absolutely. Absolutely. And with that being said, it plays a huge role in before bariatric surgery, just because if you have any gingivitis, any periodontal disease, if you have teeth that are broken down or have decay, or you haven't seen a dentist in years, I suggest one of the things is find a good dentist, one that you feel comfortable with, somebody who you can trust, and almost like they're like family when you go in to see them. And they have that compassionate side, and then be upfront with them about what you're thinking about doing or what your future holds as far as bariatric surgery. Because one, as we know, there's deficiencies when you go through the bariatric surgery. And some of those vitamin deficiencies that you may have play a huge role on the health of your gum tissue and also the teeth. So when you're going in, say, hey, doc, this is what or your hygienist or whoever you feel comfortable with telling this information to. I'm thinking about going through bariatric surgery. What do you recommend? What are some of the things that I should look for? What are the things that I should do at home on my daily home regimen as far as caring for my teeth pre and post? So, you know, one of the things that people always say is that you should go in for your checkup every 6 months. That may not be your case. Your dentist may want to see you more often. They may want to see you every 2 to 3 months, depending on your oral health that you present with when you come into the office. So if you have underlying gingivitis or periodontal disease, they're going to want to see you every 3 months. So if you have these conditions before bariatric surgery, you're going to want to stay on top of it that much more after surgery.
Well,
You know, and
that people don't equate, because I know I didn't know about it until I don't remember how recently ago I learned it, but with your teeth being so close to your brain and everything going on, if you are like, there are cases of people having infections in their teeth that have affected their brain and the function of their brain. Is that not right?
Absolutely. And that's where they may have a tooth that has a severe infection, where you have those cases where people have been affected in their brain, and also they've died from it, because you have if you have a tooth infection down here, you have a nerve that lies down here, and it can cause your throat to close off. And then also the top teeth up top, also if you have an infection in this area as well, your sinuses lie here. It can affect your sinuses, it can affect your ears, it can affect your throat. But like I said, and also all of that bacteria that you have from periodontal disease, decayed teeth, is also going into your bloodstream. So that's why it affects your heart as well. So.
Oh my God, I had no flipping idea that was how like intimately connected it was. I mean, wow. Well, then especially too after bariatric surgery, when your body's going through so many monumental changes, I could only imagine what your mouth is doing as your body's changing as well. So Dave, what are some things that you have seen from patients that you have helped who have had bariatric surgery? Are there like telltale signs in their mouth that you know things are going on?
Absolutely. One of the signs is that if you, from bariatric post or after bariatric surgery, you experience acid reflux. And so the acidity in the mouth can erode the teeth. So think of it like this. Think of it like a hill, and you have this dirt hill, and you have water just coming down this hill all the time. And eventually that dirt on that hill is going to erode away. That's kind of like how the acid does in your mouth. The acid erodes and eats away the enamel on your teeth, which it gets down to the soft part of your teeth, and it's called the dentin. And then that's where people experience sensitivity. You may have heard of some people who say they experience sensitivity after bariatric surgery, and it may be because that they have some acid erosion afterwards.
Well, and that's a really common, right? I didn't experience any acid reflux after surgery. Jason, did you experience it?
No.
Okay, but I know it's really common in our community. A lot of times we'll see revisions from sleeve to R&Y happen exclusively or only because somebody is experiencing this this big onset of acid reflux. But yeah, so if you're constantly experiencing that, then that acid is traveling to your mouth and it's basically eating your teeth away.
Yeah. Yes. So with that, you're going to want to let your dentist know that, hey, went through bariatric surgery.
Yeah.
This is some of the symptoms that I'm experiencing. Some of the things that they may recommend is putting you on doing fluoride trays. Well, one, they're going to have you come in more often for you to do more routine dental checkups, having your teeth clean, and then making sure, especially if you have any existing like restorations, fillings, crowns, and things like that. Because if you have a chance of one of the things you may have is developed from this also, the acid reflux, is it can cause more mouth caries, which is decay. You may cavities. You may experience more of that. So if you have a mouth where you have a lot of fillings or you have a lot of crowns, it's important to stay on top of that, because you can see the start of breakdown in your existing crowns, fillings, and even needing more. You may go into the dentist and be like, oh God, I've never had a cavity before. Why is this? And let them know that, hey, I'm experiencing this. And they may recommend doing fluoride trays, coming in more frequently for cleanings, placing you on some mouth rinses at home to use, and also be diligent about making sure you're staying on top of your home care as far as brushing morning and night, flossing, using some type of mouth rinse. One of the things that we used to recommend is using a ACT mouth rinse, an anti-cavity, which helps cut down on that and not having those symptoms as much. So,
wow. So for when you are working with bariatric patients, are there things that you can tell? Like, have you ever looked into a bariatric patient's mouth and been like, okay, you got some things going on because I can see some telltale signs above and beyond the acid reflux? Like, can you really tell when somebody's deficient in some vitamin levels?
I'll use this one patient for example. She had bariatric surgery. She came to us and she had bariatric surgery. I believe it was about 5 years into her bariatric surgery. And she had already had a mouth full of crowns. And she noticed that she was constantly having to replace these crowns all the time. And one of the things that you'll see is, like I said, the acid erosion.
Oh,
And
yeah.
she was having the acid erosion with these crowns. And so it was affecting these crowns. Sometimes people think when I get a crown, it's a forever thing, but it's not a forever thing. You do have to replace crowns. And she knew that's just the nature of the beast. I may have to replace these crowns more often. And the average lifespan, and I don't want to quote this, but most crowns last anywhere from 5 to 7 years. So she was having to replace her crowns more often. She was having to come in 3 years, 2 years, even at that, because it was just the effects that she was having after the bariatric surgery.
Oh, that's interesting.
Yeah.
So, Jason, have you been to the dentist since surgery? Because it's been like almost 2 years, right? Year and a half?
No.
Oh, I would be a little bit curious to see.
I do need to go. My dentist office pre-pandemic, I think was the one that I had found here had shut down. So I'm on the hunt for a new one, but with the pandemic and everything, I've just been hanging out here because I know a lot of the offices have been closed.
Yeah. Well, and I really appreciate Jay you saying too, like Jason and I, we often talk about, like you kind of have to try on your surgeon and for to see what's a good fit, you have to try on different proteins. Like we're always, having to try, quote unquote, try different things on. But it is important to know too that you really need to connect with your dentist because you are trusting them with your health, and you do need to make sure that they're caring for you the way that you want to be cared for. I mean, is it such a thing too? Like, do dentists specialize in bariatric dental care? Is that even a field that you can specialize in? Or if you go to a dentist and you say, oh, I've had bariatric surgery or weight loss surgery, and they say, what's that? Should you find a different dentist or keep looking?
Well, that's why I say be upfront about it and let them know the state that you're in or that you're getting ready to enter into. Because if they don't have a lot of knowledge about it or have a huge patient base with that, then you may want to see if that dentist is interested in doing some research in bariatrics and some of the things that will help you. I know that the dentist that I worked for, he was if he didn't have knowledge of it, he was one that would refer you to someone who had knowledge of it. So if that dentist is not well educated in bariatric surgery or have knowledge of the effects of it, then say, if ask them, are you comfortable with referring me to someone else? Because they're very well connected. They have peers that they can connect you with in their whole dental world. So,
wow. I mean, I go to the dentist religiously every 6 months. When my very first dentist died, I went to his funeral. When my orthodontist retired, I went to his retirement party. I mean, like, we are tight with our dentist.
And that's good.
It is good. And Jason, I really wish for you, I mean, I wish that you could find somebody that you love. And I know that dental care can be expensive, but there's also plans out there. A lot of insurance companies cover it. And especially knowing it's so important for our overall health. I mean, I know that when I was experiencing sleep apnea and I didn't know that I had it, my dentist was actually the guy that was like, man, something weird is going on with your teeth. You've got a ton of inflammation here. Like, your joints are really, things are just like, something is wrong. He noticed inflammation down here. It was my dentist.
Yeah.
My dentist was the guy that was like, girl, you need to go. Something is not right here.
That's a good dentist. That's a good dentist.
His nickname was Turkey Lurkey. He was the most amazing man in the world. And literally, we all went to his funeral when he passed because he was just such a big part of our family. It was amazing what he was able to pick up on. So, I mean, Jason, do you have a plan to maybe seek out a dentist in 2022?
Yeah. A while back, I had been looking into trying to find, because, in Oklahoma, I could find places all over the place that would do the kind of dentistry I need to be able to get in the door. Florida's not so much. Florida, you have to have a special license for gas, and a lot of dentists don't get it because they don't want to mess with it. And they've had tanks stolen, so they just let the license lapse because I guess people here steal, nitrous tanks. So, it's Florida. It's Florida thing. One of the laundry list of many Florida things. But yeah, no, so that's kind of the thing for me is I'm gonna be on the hunt for one that will actually do all the things I need them to do, because I can't just, I mean, I don't know that there's enough counseling in the world that's going to get me over going in there, because I can't literally, the only thing that a dentist can do that does not give me the white knuckle treatment is they can take the mirror and they can use the mirror. But once the mirror starts knocking around against my teeth, I freak out.
So this is what I would recommend for you, Jason. Call around and ask if there's a dentist that specializes in conscious sedation, and ask if you can just have a consultation with them. I don't want to be in a chair. Don't take me in your room. Don't do any of that. Take me in your office and sit down and talk with me and let them know and express your fears. And then once you build that relationship and have that rapport with them, let's meet one-on-one, face-to-face first. But if you can't find a dentist that can't sit down with you and meet with you one-on-one, face-to-face, knee to knee, eye to eye, then move on to the next one. Because the person who's going to take the time and sit down and does that with you is the person who you're going to feel comfortable with, and it's going to give you the best treatment.
Yeah, that's true. I need to look into that. I definitely, because I know that it was either right before or right after surgery that I really went on the hunt for one, and just never, they were all just like, yeah, no, we don't do that. And I'm like, well, do you know somebody? No, we don't know. We don't know anybody that does like that. Like, no, they were less than amused to try to assist. So I just kind of at that point gave up after call. I mean, I called, I want to say over a 2-day span, I called probably 20 offices, and they were all just like, yeah, no, whatever, kick rocks. And so at that point, I just, I gave up, because I was like, well, I guess Florida doesn't care, because, they're just not worried about it. It's kind of like mental health here. It's kind of one of those, wives' tales. They're like, oh, that's not really a thing. Like, people talk about it, but it's not real. So,
I just don't get it. Dental care is so important. I mean, it just flabbergasts me. And the only reason that I learned a little bit about your dental backstory is because when we were at retreat, I was harassing you because you weren't smiling, showing your teeth. And I was like, Jason, what is up with you? And then you were like, I hate my teeth. And I was like, what? And then we went down that whole road. But I just, it's not my personal experience, but I don't know. I mean, I know the gift that healthy teeth and just showcasing a smile is. I know, Day, you and I, we've talked a lot about like how important our smiles are.
Yeah.
And it just breaks my heart when I meet people and they're just not proud of their teeth. They don't even like to show them. They've struggled with dental health. I mean, it's like, oh my God, it can be such like a cool part of your life. And when it's not, it's like, oh, it's kind of a bummer, especially Jason, you've done the work, you've lost so much weight, you've come so far, you've really transformed into this, person. It's like, oh, and I get that it's almost like, okay, well, here's one more thing now that I have to focus on. Like, okay, I did the weight thing. Now I got to move on to teeth. It must feel like it's never ending. Like, oh, cool. Now this.
Yeah,
Well,
a little bit.
April, you mentioned something, and that is very key, that when people say going to the dentist, on top of the second thing that people fear is the finances, the money part. So you said there's things that people look for a dentist that offer programs. One is Care Credit. Care Credit is huge. They do a 1 year, no interest financing for people who are looking to do dental work. Also to see if your office is willing to do payment plans. That's another option. So there are entities and there are resources out there so that you can be able to go in and see, because I know, yes, I'm not gonna lie, it is expensive. Dental care can be expensive at times, but if you go in and you manage it and you maintain it, that's where it becomes more manageable. But if you have underlying conditions like periodontal disease and broken down teeth and things of that nature, that's when it can be more expensive. And that's the things that people fear. But it's the start of the year. Let's make goals for the new year. Let's make some goals for the new year and say, hey, you know what? At least just go in and see what they have to offer. You got to start somewhere. And a lot of offices offer, a special where they come in and they do the x-rays and exam at a discounted rate. So if you don't know, you don't know. So go in, see what they have to offer, have them do you up a treatment plan, see how they can break that down and make it more manageable for you.
Well, thank you, everybody, to coming to Dave's TED Talk on why dental care is so important for us before and after bariatric surgery. I mean, you know I am passionate about this. Jason, it's my mission in life now to get you passionate about this as well, because I love healthy teeth and smiles. And I just want, I know we all know the struggles, like bariatric surgery, one more thing. And you are right, Dave, dental care can be very expensive. But if we're not at least having conversations with dentists or people that can help us, if we don't have a full understanding of what the true picture is, then we're just making guesses and assumptions at that point. And we just don't want to do that. We've gambled with our health for so long before bariatric surgery. We went through this monumental, change of having this surgery. We're committed to our health. And I think sometimes we get this, we reach this point in our recovery and it's like, oh, okay, I've finally done what I needed to do to my health. But that's not true, right? We talked to another very prominent member of our community this month about how healthcare and staying on top of our health issues is part of self-care. Dental care is just another way of practicing self-care and healthcare, right? It's like when you start to peel that onion back, you're like, oh, another layer, oh, another layer. But this is kind of what it takes to live a long, happy, healthy life. So, we got to do it. We just have to do it.
Absolutely.
Oh, goodness. All right, Dave. Well, we always love to give our guests the floor at the end of our conversation. Is there any bit of wisdom or anything that you'd like to pass along to our listeners and our watchers about not only dental care, but maybe self-care, since that's what this month is all about?
Well, thank you. First of all, I'd like to say thank you again for allowing me to come on and to speak to your audience about oral care, overall care. It's not just about oral care, it's about overall care. And like you said, caring for yourself. And like you said, when people see us, they see our smile, and our smiles say so much about us. It's people come to us, they're drawn to us by our smile. So when you don't feel confident about your smile, sometimes you don't feel confident about yourself. So see a dentist and encourage yourself. Say, hey, I can do this. And I'm going to encourage you. I can do this. If I put forth what I'm going to do to care about my overall health, that's part of it. So continue on that journey, that path, and see a dentist, brush, floss, do the things all that you need to do at home. And also I want to leave on another note, on the other side, and not so much dental, is my whole thing is self-affirmations. Regardless of what your smile looks like, because everybody may not have the perfect smile, or you may like that little crooked tooth, or you may just be like, you got a Michael Strahan gap, and you may be okay with that. That's all right. Just because how I perceive my smile to be doesn't mean that you're not happy with how your smile is. Say, my smile is beautiful to me. I don't care what anybody thinks, but it's me. And that's what I love about me. Love who you are, love the person who you see in the mirror, and be excited with who I am and who I'm becoming and who I'm getting ready to be in the future.
Boom. Fire. If you ever need to pick me up, just go connect with Day. That's all you have to do. That's all you have to do. Day is a master at helping you flip that mindset. And you and I have had a personal conversation about this too. We don't have to believe what we're saying to ourselves. We just have to start saying it, right? So if the conversation is as simple as, I am going to go see a dentist, even though you're like, there's no way in hell I'm going to go do that. Just start saying it to yourself, because you're getting your mind in that right way.
Yeah.
And just like what you said too, Dave, like, my smile is beautiful. It doesn't matter if nobody's seeing my teeth, my smile is beautiful. My health is worth it. I'm worth it, right? Just getting in the habit of saying these positive things to ourselves is the bariatric journey in a nutshell. So we can definitely take it to that next level and apply it to our oral care as well.
Yes.
Day, where can people find you if they'd like to connect with you about all of your many facets of life?
If you would like to connect with Day, you can find me on Day to Day Creations on Facebook and Instagram.
Yep. And if you're watching this, it is linked right there. It's Day_Day Creations. She does some amazing things, and her market, you guys, is amazing. If you live local to Day and I here in Western Washington, it is definitely worth the few hours to go spend at the South Hill Mall, because it's rad. Absolutely.
And then also don't forget to go to the Berry Nation store and get your merch, get your hat, get your tumbler mugs, blanket, all of that.
Dude, those tumbler mugs, I don't know. It's like some type of magic. The ice stays in those things for like days, and it stays so flipping hot. I made tea in it the other day, and it was hot for, I swear to God, 12 hours, like hot. And I was like, I don't understand how this happens, but it does. And they're adorable, and they are literally handmade by Day. So that's what makes them extra. I was just thinking you start signing the bottom of them, just so people know, nope, I made this with my hand. This is all me. I love it. Day, thank you so much for taking time out of your day to join us today. We very much appreciate it. If you are new to the Barry Newson universe, we've got all kinds of supports for you. Every Sunday, we shout out a member of our community. It is simply you, your story, and a platform for you to celebrate all of the amazing work that you're doing. It's not a paid thing. You don't have to be a community member. Just head to our website or head to our Instagram handle, click that link, and fill out the shout out Sunday submissions. The other cool thing that we really want to start highlighting are your questions that you have about bariatric surgery on our podcast. So if you go to our Anchor homepage, there's a little message button there. You can click it right on your phone, ask a question, leave a comment. We can incorporate it into the podcast episode. And then, of course, you know, we got the Barry Nation membership community. Day has been in there. She knows it's straight fire. It is an amazing place to get an extra layer of support along your journey. We partner with over 15 experts. We're talking therapists, registered dietitians, wellness coaches, certified personal trainers. The list goes on and on and on. We have live support groups and cohorts that are led by therapists. We have live events that are hosted by our creators. We've got peer-to-peer support meetups. I mean, it's like, I could go on forever. Head to our website, www.barrynation.com, to learn more about it and become a member today. Oh my God, Jason, I think I did it. Whew.
And we have a 14-day trial going on. And we also have Rob, My Way is History, has now moved Men's Support Monday into Barry Nation starting tomorrow.
Yes, I am so flippin' excited about that. And I mean, Rob is an amazing human, number one. And it's so awesome that we now have a dedicated place for just targeted men's support. But it is important to know Berry Nation is an inclusive community. So no matter if you are a man or a woman or identify as a man or woman, it does not matter. That is a support opportunity for you. And it's not specific to a surgery type. It's literally just bariatric patients getting together with other bariatric friends to talk about what we are experiencing in the moment. And yeah, and Rob's just like a firecracker on his own. So, I mean, all good stuff there.
Absolutely. Dave, we want to thank you again for your time today, all of your knowledge and wisdom. We appreciate that so much. And we appreciate all of our listeners and followers for the likes, the shares, the subscribes, the word of mouth, the letting everybody know about Berry Nation, the podcast, for the community or the Instagram. Getting the word out there is how we help other people, which helps ourselves in the return. So we appreciate that. Don't forget, you can also leave comments and ratings on our YouTube channel, as well as your favorite podcast player. And also Spotify. If you're listening to us on Spotify, you can go leave ratings there, because that's a better way to help us get out there for other people to see. We can become one of the top rated podcasts with your help, which will allow more people to see us, so they will advertise us that way. So if you have not done that yet, we would appreciate it if you would do that. And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time.
Awesome. Thanks, Dave.
Bye-bye.
Bye, thank you.